This is the Blood Bank Guy Essentials Podcast, episode 037. Hey everyone, this is Joe Chaffin. Welcome to episode 37 of the Blood Bank Guy Essentials podcast. I'm super glad that you're here with me today because I love this topic. I love what we're going to talk about today. Before we get to that, I want to just mention once again, you've probably heard this already, that my website, bbguy.org, and the wonderful website, transfusionnews.com, we've joined forces to try and bring you a great combination of current news and education. Transfusion News is a site I'm sure you've heard of. They provide the latest news in blood banking and transfusion medicine, and they feature the wonderful transfusion medicine question of the day. As of right now, you can find my podcast episodes on their site, and you can find their news items on my site, but we are coming up with a really, really cool educational feature that's going to be announced very soon. This podcast is coming out in August 2017. The project may have already been announced. I hope so. Anyways, by the way, you should be aware that Transfusion News is made possible by support from Bio-Rad Laboratories. Now, on to our topic for today. As I said, I love this topic. I want to ask you a question. What if everything we know or think we know about learning is just wrong? Quite honestly, I was in school for a heck of a long time in my life, including college, medical school, residency, all that. And my personal learning style is that I always just kind of read things a lot. I reread them. I had a really funky, complicated highlighting system with yellows and pinks and combinations to make orange and all that stuff. And I would read and I would reread and reread. And I admit I'm fortunate because I have a fairly strong working memory. So I was able to use that style and kind of survive. But what I realized down the line is that long term, that didn't seem to work very well for me in terms of having that information in my brain. Well, here's the thing. There's been lots of research done in recent years about how our brains work and how we learn. And I don't want you to miss this because it's really important. Please don't think that this podcast doesn't apply to you because you're not a quote-unquote learner anymore. Remember, I always say at the end of every podcast, never, ever stop learning. Well, this is forever. Everything that we're going to talk about today is us being lifelong learners and how you can understand your brain and how you can keep learning permanently. My guest today is someone who has really studied this, and that is Dr. Justin Kreuter from Mayo Clinic. Justin is a pathologist who trained at Dartmouth, who did his fellowship in blood banking and transfusion medicine at Mayo and is currently at Mayo Clinic, as I mentioned. He has responsibilities for both the blood donor program and the HLA laboratory, and you can find him on Twitter. If his name sounds familiar, he was on my Twitter podcast, episode 31, and his Twitter name is @KreuterMD, Kreuter. One last thing before we start, be sure to visit the show page, which is bbguy.org/037. Teresa Malin, who is an MLS at Mayo Clinic, has done an excellent infographic summary of this entire interview. It's really cool, and I hope you check it out, bbguy.org/037. Okay, no more waiting. On to my interview with Dr. Justin Kreuter. Hey, Justin, welcome back to the Blood Bank Guy Essentials podcast.
Hey, Joe. Thanks for having me.
Man, it is so great to have you here. I wanted to talk with you. I've wanted to talk with you for a while about something that I know is really, really near and dear to your heart, and that's new methods of teaching and learning. You are someone that I really consider a leader in that area among pathologists and really among doctors in general. Before we get to that, I'm just curious about your story. How did you get involved in transfusion medicine? What kind of pushed your buttons to move into that field?
Yeah, good question. I started off really interested in pathology, loving the how and why questions. And when I was exposed to pathology, I guess classically, I was exposed to the slap and glass anatomic pathology side of life, and I loved it. In fact, I still love it, and I actually do attend the AP conferences here at Mayo when I can, even still. But when I went on to ClinPath rotations. It was my first weekend on call for transfusion. I remember I was in the hospital doing a plasma exchange procedure, and there was a young woman who was being life flighted over to us. And I guess the long story short, it was quite the massive blood transfusion. And at Dartmouth, we were in the ORs, bedside for all the major bleeds. And it was a real powerful moment for me that playing a role in this young woman's life. In the end, this ended well. And it was one of those times where I think it was on Labor Day weekend. And so Tuesday, I saw one of the dermatopathologists who was like, "Oh, Justin, what's going on?" And here I was probably living off just a couple hours of sleep, and I was just felt so alive from being part of the team and involved in patient care, yet involved in patient care in the way that I find really exciting. From a coagulation, and now what I'm doing with the tissue typing, organ transplant stuff. I'm also very involved in the immunology side of transfusion medicine, and I just find that pretty darn thrilling.
It's fun stuff for sure. Well, were there any particular mentors or people that influenced you that you wanted to give a shout out to?
Oh, sure. Ziggy. So Dr. Ziggy Shiperkowski. He was one of my core mentors from the beginning, doing my residency at Dartmouth. And I think for him, I mean, one of the things that sticks in my mind was, whether it was 3 p.m. or 3 a.m., he was doing the same dedication to patient care and explaining to me what we were doing. In fact, I mean, if at 3 a.m. we were having a conversation, then after talking to me, he would ask me, well, based on that, what should we do? And if I gave what was obviously the wrong answer to him, he just, started re-explaining why maybe to go with the other choice. So he really took the time. I love it. In fact, he's the reason why I'm the bandit of blood these days. I wear my bow tie proudly in honor of Ziggy. And then, Dr. Nancy Dunbar, who's also at Dartmouth, she came my last year of training there. And I think it was really powerful to see, having always been around, fantastic blood bankers. Ziggy, Dr. Aubuchon was there at Dartmouth my time in the beginning. To see these fantastic blood bankers. With Nancy, she really showed me how somebody who right out of training could still play a huge role in patient care, and certainly even being fresh out of fellowship, she very quickly earned the respect of all the staff there. And so she really showed me how somebody could come out of training and really make a difference.
Oh, that's awesome. Awesome. We're going to talk about 3 main topics today in terms of these new methods of teaching and learning. But before we get to them, I really have to. I got to tell you, Justin, I'm putting on my crusty old pathologist hat here now because I'm a much older guy than you are, and I'm gonna put my feet up on my desk, and if I smoked, I would puff a cigar right now, and I'd be saying, Justin, I have taught residents for X number of years, and these newfangled things that people are trying to make me do, they're just crazy. They want me to. They're talking about flipping classrooms and let the students direct the learning and give fewer lectures. Justin, fewer lectures. Oh my goodness! Wow, how is all this even possible? I mean, come on. So, realistically. Why is all this coming about? Where is all this newfangled information coming from?
There's a lot of information coming out now, and honestly, a lot of it has come out of K through 12 education that has been filtering up actually through the development, and it's also at the same time, we're looking at medical education, and we're not being as effective as we think we are. I think something I noticed for myself one day one day early on in my training, I spent a significant amount of time, going through coagulation with one of my trainees. Just, spent a good solid, hour and a half with a Sharpie and a pen and a paper and went through everything soup to nuts. And I kind of thought I really, it was a lecture I gave her, and I thought I had done good. Went home that night patting myself on the back, and then it was like a week and a half later, coagulopathy issue came up, and I was like, oh, please, how do you think we should do this? And, I was, all excited. She just looked at me and shook her head. I don't know, Dr. Kreuter. And that was a nice wake up call for me about, just lecturing people it's passive learning, and that's the old way, and that's the way that, we have traditionally brought up in education. I think there's a lot of history there. K through 12 education was all based on the lectures, because the lecturer was the one that had the knowledge and experience. And certainly these days, when we're talking about graduate medical education, or also in SBB programs or MLT, MLS programs, learners are coming to us with a certain set of experiences and applying these in various scenarios and situations. And that lecture, it inhibits, there's a transferability issue there, whether what you learn in a classroom you can actually recall when you're actually at the bedside or you're at the instrument interface, confronted with these issues. So I think it's a combination of, there's a lot of new research coming up down below. There's a lot of questions being looked at for ourselves about how effective we are being. And then we also have the issues of can things like medical school or training be shortened? And when we're talking about things like competency-based medical education, CBME, how effective certainly plays a huge role. And then I think personally for me, that was another thing that when I came on staff, the first year you're giving a lecture over and over and over, it's not fun. And these new ways of doing things, as I use, we'll talk about, I'm sure, the flipped classroom. Every experience I have is a new experience. We talk about different things in each situation, and that's really predicated on the learner in front of me and what experiences are they bringing into the classroom, having had, and then also what do they need to learn.
I think there's two things that I you made a lot of great points. There's two things that I want to just hone in on quickly. And the first is just the last thing that you said there. And I think that as people that have been around as educators for some time, as well, myself specifically, but obviously the many educators out there, I think it's easy to hear stuff about quote unquote new methods of teaching and learning and somehow get the impression that we as educators are becoming obsolete. But what you just said is so important, because if for example, in the flipped classroom, if you're looking at things differently, if things are different every time, you need the experience and expertise of that educator to adapt. So it's not a phase out of the educator. It's kind of a retasking of the educator. Is that a fair way to put it, Justin?
Absolutely. I often think about it as, it's a partnership, much like that a laboratorian is partnering with the clinical physician, or a pathologist is talking with a physician on a case. The educators that are really nuanced in this new information and data that's coming out, they know how to set things up, structure things, give advice. We still are the content experts, and although we may have fantastic tools for educating people at our disposal now, this puts even more pressure, I think, on the physician experts and the laboratorian experts to bring our knowledge to the table.
Okay, and the other thing that I wanted to hone in on, Justin, is you used kind of a buzzword in the midst of that discussion previously, and you said the word learner, and I think I want to I don't know, kind of focus on that a little bit, because we have traditionally talked about people that are in the quote unquote learning process as, for example, use the word trainees, and I wonder if you would just address the whole learner versus trainee thing. And further, I know that some people are listening to this podcast right now and they're going, well, I'm not in an educational environment. How does this podcast apply to me? Talk us through what it means to be a learner and how long that process goes on.
I mean, I think we talk about lifelong learning. I think this podcast is important for residents, SBB students, laboratorians, attendings. I mean, when you're talking about resident and SBB students, they certainly are. It's obvious to talk about in the education throes of things. And we're talking about laboratorian attendings, people that have their certification. It's still important. I mean, that's one of the things I talk about with my graduating residents and fellows is, very soon in your future, somebody isn't necessarily giving you reading assignments or saying what has to be done. And, there's going to be, maybe 10 years before you have to recertify or a couple years. But we still need to continue to grow and learn. And so, what are you learning? How are you figuring out what you're going to the upcoming AABB meeting if you're going? How are you going to select what to go to? It's very easy to say, I'm interested in topics A and B, and I'm just going to go to all those. But for your practice, is that really what you need to go to and learn? Are there what are your weak areas you need to go to? And so I think that mindset of we are lifelong learners, no matter what role we're really in. And that is a critical skill to develop for us who are professionals in the laboratory and who are physicians, to be able to critically assess ourselves, know what knowledge, identify what knowledge we're lacking, identify how we're going to, what goals we need to achieve, and then figure out what's the pathway to gain that education, that knowledge.
I have always said that my website, the Blood Bank Guy website, and this podcast is targeted towards learners. So I guess that really just opens the field to pretty much everybody, right?
In my opinion, yes, absolutely.
Fair enough. So Justin, before we move on, there is something I want to clear up, and that's I want to make sure that people understand what this discussion today is not about. I think that if you look online, you can do a Google search of learning styles, quote unquote, and you can find just an enormous number of different categorizations of learning styles. And I think that it's easy for people to think about when they hear about new methods of teaching and learning, they think, oh, well, what that means is, for example, some people are, quote unquote, visual learners. Like me, I'm kind of a visual learner. Some people are auditory. Some people are more hands-on or tactile or kinesthetic or whatever the categorizations are. What I hope you would expand on is, are we talking today about tailoring our specific ways of teaching to each and every person's individual learning style? Does that work? Do we have evidence whether or not that works?
Yeah, absolutely not. So there's not evidence that has borne out to say that learning styles is something that is a thing to take into consideration when designing what you're going to do. However, interestingly, there are things in cognitive psychology that we learn about that help us learn, and we'll probably talk about those in further detail later, but where having stuff in video form and having written content are complementary to each other. I mean, that can help strengthen the learning, but it's not to say that we need to develop all videos and the people that are visual need to just watch these videos or something. That interestingly hasn't borne out, but certainly has gotten a lot of talk in the common press, but there's no data to back it up.
Okay. All right. Good deal. I wanted to clear that up because I think that's a really common misconception when people think about new methods of learning, and even as far as competency-based medical education. It's a different thing that we're hitting. So let's move on and do your core topic number one, which is developing habits of inquiry and improvement. So what would you like to say about that? How do we start developing those habits?
Yeah, I think that's really, I think we start it commonly now, we start it by having residents or students identify projects that they're going to do. And I think that's how we start to introduce this sort of aspect of looking critically at what the practice is and working on improve that. I mean, certainly in our fellowship program, all of our fellows have to participate in a quality improvement project. There's a lot of training programs that have that kind of a point to it. I think one of the key things, though, is we need to move that from something that is a program requirement to think about how are we going to integrate this in our lives. And for those that are listening that are trainees, the time is, I think, now to start thinking about that and realize that in the very near future, you're going to have to figure out your own topics and projects, or with your team, figure out what projects to tackle and move forward, as well as, like we said, your own fund of knowledge and expertise. How are you going to ensure that you're maintaining your professional expertise and continuing to evolve as our knowledge evolves? And those of us that have completed training, who are in the laboratory or in our physician's office, how are we going to continue that process then after we've graduated?
So what kind of questions should we be asking ourselves to make sure that we're, as if we're in the position where we're in training or resident, SBB student, CLS, MLS student, for example, and we're trying to get that professional identity formed. How can we figure out what to do? I mean, what are the questions that we should be asking ourselves?
So there's a process that's out there in the literature called critical reflection, and I think I'll send you a paper that we can put in the show notes on that. And it really goes to a process of critically asking about events that have happened and figuring out what kind of went wrong, or in your practice, if you reflect on what do you feel weak on, and then once you've identified kind of areas that you want to concentrate on, figuring out, okay, what's the goal that I want to have in 3-6 months, whatever. Once you kind of figure out the goal, then you have to figure out, okay, what's going to be my process to achieve that? What tools am I going to have to use to achieve that? And kind of working back down the line then to where you are today. So I think that's the question is, where are my weak spots? What's my goal here? And what am I going to be employing to achieve those goals?
And that sounds like something that's useful for not just I keep wanting to use trainees because I've told myself don't say trainee. So now I'm going to say it at every opportunity. But what for those who are out of training, it seems like those are the same kind of questions we should be asking of ourselves, aren't they?
Absolutely. I mean, I think that's something in my mentors that I've always seen, the physicians that I look up to, the ones that I see are continuously improving and engaging with the literature, writing the literature. I see this as just become a behavior and a habit that they do, and certainly as I've gone down the education rabbit hole quite a bit, that's something else too. There's a phenomenal book called Self-Directed Learning by Malcolm Knowles that kind of talks about this process of identifying your path. And so I've seen it in my mentors, and then in the education world, it's certainly backed up and made something that you sort of felt, you saw that they were thoughtful individuals, and then it's nice to kind of see this process codified out as well.
Yeah. Okay. So with core topic 1, we've talked a little bit about questions to ask and ways to develop those habits of inquiry and improvement. Let's move on to core topic 2 and just talk a little bit about something a couple of buzzwords that we're hearing a lot when in the literature and in common discussion about the two words standardization and individualization. And I think there's a lot of discussion about that. And honestly, when you just look at them, it seems like they're opposite things. Standardization, everybody goes the same way. Individualization, everybody does their own thing. How do we resolve those, and do both of those terms and concepts have a place in modern teaching and learning?
Yeah, I think so. You don't have to have an existential crisis to get your arms around it.
Good, good.
Yeah, I think the way to think about this is the outcomes we are going for, those are standardized, right? What we think a pathologist should know, what those thoughts, habits, behaviors, knowledge, that is standardized. For a laboratorian, what we think that somebody that's got an MLS degree or an SBB degree, that's standardized. We know what that person should look like. But then the pathway that we take to achieve those standardized outcomes, that's where the individualization comes in to play. Certainly, we all have, it's easy, I think, for us to recognize in ourselves, thinking back to our own education, there's some times where we were quick to grasp concepts. There were other times we were slow to grasp concepts. It makes sense that, we're going to have to follow our own individualized path if we're going to get to some standard outcome. So it's standardized outcomes via an individualized process.
Okay, well, and that brings us back, I think, to something that you mentioned before, and I think I'd like to have you just kind of take us from the beginning. Again, another buzzword, the flipped classroom, or quote unquote backward design. So if you could just kind of compare and contrast the current thoughts that people are having about how to design curricula and how to design educational experiences for people, with the way that it was traditionally done and the way that seems to be a better and potentially individualized, as you said before, way to go with the backward design and flipped classroom.
Yeah, so starting off with the traditional way that we have done things. And, maybe it's not fair the way I characterize this, but, for the first 10,000 PowerPoints that I made, if I were to be honest with myself, my process was, sit down, open a textbook or pull up articles, each thought had its own slide, and I would develop a slide set or, thereabouts. And then, I'd have to turn in my slides and, you then sort of say, okay, well, what are my objectives? Well, and then you would write your objectives based on what content that you had or that I had put together. And then, now that people are asking for, in order to get CME, now people are asking questions. So, then you might just go and look at, well, let's see what I talked about here in this PowerPoint. Let me ask 3 to 5 questions based on this. And so all this stuff gets developed, and I guess when I give talks on this, my sort of image in the back is, these are all haphazard, right? You've got the thing that drove everything here was just whatever content I slapped together in that PowerPoint, right? That's the thing that in the end drove where my objectives that I wrote and drove my assessment. And so in the end, who knows where I'm pointing these learners that are going before me here, right? And this is where this backward design approach comes into play. So the idea is I sit down and say, okay, where do I want my learners to be? What's my goal? And so I write my goal down. And then going back now from the goal, well, what assessment am I going to have to give the learner to know that they've achieved this goal? And then I've got that's my assessment that I've got down. And then I can back up from that and say, okay, what objectives with my educational intervention do I want to achieve so that students will be set up for success on the assessment? And then backing up from that, then, okay, what educational thing do I have to do so that my learners are achieving these objectives? And so right there, my image that I'm usually displaying is that all this is lined up with a big arrow pointed right to and running smack into those goals. Because if you follow this process of working backwards and having the goal be the thing that is driving every decision, there's no way for the learner to go except to reach your goals. And I think, for those of us that have, slaved over these PowerPoints and stuff and, putting content and, do I want to put this in or not want to put it in the old ways, I mean, maybe you sweat it and maybe you put a bunch of stuff in that was less important to the learners, but you thought it was kind of a cool point. In this new way of doing things in reverse design, it gets really easy. It's, is that objective, or is that content that I want to put in that PowerPoint, is that lined up with an objective? Will this be assessed? Is this going to be leaning towards your goal? And that's really the driver. So the goals, if you start with your goal as your driver, it makes everything line up, which makes everything actually very much more simple for the learner. And it actually makes things a lot easier for us putting those PowerPoints together.
I'm sure. So what you've just described, clearly it's a paradigm shift, and clearly there's for us as educators, for those of us who are in the position of educating folks, that looking at it that way. Absolutely agree that has some wonderful possibilities for changing the way that you look at things. But further, you said before that the experiences are different. So there must be more to it than what you've just said. Is there anything more in terms of, for example, what learners are experiencing before they even get to your presentation that's different in the new model?
Yeah, and so then the design is this backward design. And then in terms of what I actually do with my education now, that's where the flipped classroom comes into play. Okay. And that's where, if we're thinking about our traditional classrooms, students came to lecture. We would give them a talk, and then afterwards there would be a test on that. In medical school we had shelf exams or board, step exams based on the content that you learned in those sessions. And the problem there is that the application of these issues then falls to after the classroom, and the learner is struggling with what that means and how do you apply this challenging topic that you're talking about? How does this apply to the patient who is bleeding, for example, right? Mm-hmm. And with the flipped classroom, what you do is you just you flip it such that the didactic learning is given to all the learners before coming to your classroom. And then with that face-to-face time, you're using it to apply what they read about or watched ahead of time. And then just like in a baseball swing, I mean, there's follow through too. And then the ideal is afterwards in those sessions. And here's where, in my experience, that I've seen is the pinnacle of the flipped classroom is that you reach students and they want to take it further. So I've had the last 2 years, I've mentored two quality improvement projects with our critical care fellows that have won awards and gotten recognition from the institution. So certainly education making an impact at the patient's bedside, that is the pinnacle of what this is all about. So the idea with this flipped classroom, by getting this knowledge beforehand, people that are slow learners can spend more time with the material. Those that are fast learners, or if somebody's already had it, they can skip through it. They can come to you. They say, I already know it. I don't need to spend time on it. And then, and that's fair. And then with that face-to-face time, I'm not sitting there talking about antigens and antibodies or coag factor. I mean, I am at that point. We are struggling then with how does this apply in patient care, and my time is really spent talking about the nuances and the exceptions and how this plays out. And then, like I say, that after effect is just wonderful when students are coming back and they have now really integrated and they've kind of seen this knowledge and want to make a difference in their patients' lives.
That's awesome. That's awesome. And that really is, as you said, that is a big change. I can certainly, I'm guessing you probably experienced this as well during medical school. Can remember sitting, now granted, I was in med school a lot earlier than you were, but sitting in classes and going, I just want to die right now because I know I'm going to have to remember all of this and there's no possible way I'm going to. But I have to admit, forgive me for interrupting, Justin, I will tell you that in my own personal limited experience with this, when I knew what was coming, when I knew the topic that was going to be discussed, even if I skimmed the material beforehand in a textbook, a dry, boring textbook, it made all the difference in the world to me to how much impact the actual lecture time had on me. So just that little thing showed me that what you're talking about has that enormous potential.
Absolutely. Absolutely. I think this makes a huge impact. It's something that I think some listeners may say, well, hell, we've been doing this for years. I always give things out ahead of time. I think one of the challenges that as a system we have to work on is to change what the expectations are. I mean, although I've had faculty members hand things out and reading ahead of time, how often has that reading been the focus and topic of discussion afterwards or during that session, right? I think the flipped classroom, certainly when you do a lit search on it, there's plenty out there of how it's gone fantastic. And I have to admit, there's just about as equal enough out there to say how it has not gone fantastic.
Really? Okay.
But I think that the thing that I would say here is that it's very much important, as you pointed out earlier, to collaborate with education specialists that work at our institutions, because I think it very much hinges on how this is rolled out. In other words, if I'm the only person giving a flipped lecture at the medical school, I'm going to have to do a lot more prep and make sure the students know what I'm expecting of them before they show up that day. Because if I don't, they're not in the habit of prepping in this way for class. Likewise, for faculty that are giving these sessions, it's a different skill set to give a lecture versus facilitate. And when I say facilitate, I'm kind of like on the side, facilitate a discussion amongst the learners or that are in the room at that time.
Yeah. I completely agree. And as someone who has spent most of my life doing lectures, I can tell you that my perspective on this is that it's a lot more fun for me to interact one-on-one than it is to stand in front of 200 or 500 people and give a lecture. There's that one-to-one interaction is beautiful, and it doesn't. I mean, that doesn't mean I don't like giving lectures, because I do. I mean, I've done it my whole career. But that one-to-one, that time when they're bringing questions to you and you see the light go on, and I know you're an educator. You know exactly what I'm talking about.
I'm nodding right now. Yep.
Yes, the light. It's the light. The eyes are dim, then suddenly, bang! The light goes on, and you're like, "There's nothing better as an educator than seeing that."
Absolutely.
Yeah.
And now, if they take that, the light goes on, and they're making a difference at the bedside. Their eyes are now open to systems issues. That's where a lot of powerful change can happen.
Agree completely. All right. Well, so just to summarize, we've discussed in core topic 1, developing some habits of inquiry and improvement, including some reflections, doing critical reflections, things like that. We've talked about standardization and individualization, and that they're not opposites. You don't have to freak out, and some wonderful talk in that about backward design and flipped classroom. But we need to get to number 3, because I want to give us time to explore some of these. Justin, you've got some things to share with us in terms of just rubber meets the road stuff, how to study. And again, just for everybody, this does not just apply to people that are in a quote unquote learning environment. As Justin mentioned before, we're talking to all of us. All of us should be learning lifelong. So I'll turn the floor over to you, Justin. Take us through some tips that you have on how to study.
Yeah, this is all from, or where I point listeners to. There's a fantastic book out there called Make It Stick. The Science of Successful Learning. It's phenomenal. It's the book that I wish that I had read probably when I was going off to college. It's the book that this summer I bought for my sister-in-law who is starting medical school.
Nice.
And it's the book that actually I try to integrate a number of these processes in my own continuing medical education. Yes, I still use index cards. And yes, I've got a little coupon saver that I use to kind of flip through these note cards on a frequent basis. So there's about 6 of these down here that I think just wanted to mention and get in our minds. So running through them, it's retrieval practice, space practice, dual coding, interleaving topics, concrete examples, and then elaboration. So starting from the top, retrieval practice, this is where, we need to think about what we're learning, and sometimes we're given questions that are kind of fill-in-the-blank style questions, or, I think we can certainly make up our own, and having just completed the question answer book revision for AABB, that's a huge challenge, and at the same time, there's a huge amount of learning comes out of making our own assessments. So I think for people that are in training, you don't always need your professors to give you questions. You can work on trying to get your own assessments out there. And certainly for those of us that have completed training, the practice of developing a good question is a very powerful learning experience. And actually to do it in teams, having been now part of the transfusion fellowship program here at Mayo Clinic with Dr. Jeff Winters, he can twist a question like you wouldn't believe. I'll make a question and he'll look at it and go, this is how we can make this, and it's a phenomenally more instructive question. So that retrieval practice, not just looking at something and being able to recognize something, but can you really fill in the blank and remember something?
So Justin, before you move on to the space practice, there is one thing I want to kind of drive home with that, and I promise I won't jump in on each and every one, but something that I've been looking at recently that I think fits in under retrieval practice. You tell me if I'm wrong. Is that I think as learners, oftentimes we make things a little too easy on ourselves, and there's a theory out there about desirable difficulties that I'm sure you're familiar with. That I wonder if you just comment on how much we should challenge ourselves.
Oh, yeah, no, I'm glad you brought that up. That is huge. So when we're talking about that, I think if we're just given the answers on something, like it feels good. There's this little cognitive problem that if I just read over the book again, like reading over my notes, certainly because that was a major part of studying in college and medical school and residency. Yes. I feel good mentally. I get a little reward because I'm like, oh, I remember that. Yeah. And then it comes time for the test and I'm like, oh geez. You're sitting there in that path board exam saying, oh, is it A or C? Oh, so, and then also I had it recently now, I had a resident, it just goes to show that there's our minds like to take the easier route where it isn't challenging and hard. I was talking about DIC with one of my learners, and I was having her work through the process on the whiteboard, and she trying to be polite and just, oh no, Dr. Kreuter, you please, you teach me, get up and profess DIC and transfusion medicine, and that's it's a lot easier to sit in the audience and listen to something. It's a lot more difficult to generate the knowledge yourself. But certainly from that story I just told you, there's infinitely more advantage that comes to the learner who has to be uncomfortable in front of the whiteboard. And certainly as an educator, then I can figure out what the person knows, what they don't know, or what they have misunderstood. And certainly also from somebody who's studying for an exam, beware, as my eyes had not been open to the fact that I would feel good about reading through my notes, but that really doesn't. The studies show that does not mean that you know that knowledge. It does not mean that you can apply it when the time comes.
Absolutely, and that little bit of discomfort, or maybe in some cases a lot of discomfort. And to be clear, we're not talking about beating people to death with this. We're talking about making it somewhat challenging. But that, I believe, the theory at least is that makes some tighter connections in your brain. That puts it in a place where you can bring it forth more readily. Is that correct? Yeah,
there's that inverted U shape, right, of anxiety, and having a little bit of anxiety results in better learning, but certainly being stressed out is going to inhibit that learning as well.
Not so good. Agreed.
So
all right. So
beatings.
Forgive me for that interruption. Yes, no beatings. That's if that'll be the buzz line for this podcast. No beatings. I like that. That's the tagline for the episode. All right, so go ahead, Justin. You were going to talk about space practice.
Yeah, so space practice is the next one to go at. So, when we have these, you come up with these questions, that's where I put them on a note card. I put them in a little, coupon saver thing and separated it out. And as I ask these questions to myself each day and get more familiar with them, they go further back in the coupon box. And periodically I go back to the ones that it's been a little while. But that space practice that gives you from a cognitive psychology perspective, that allows you the opportunity to recall what that answer is, bring it into the forefront of your mind, which is going to then strengthen that memory and that knowledge that you have before it goes back into those recesses of your mind. So it creates additional connections, gives you more context to remember. So it really magnifies that retrieval practice.
So in other words, maybe don't study blood bank for the a month that you're on the rotation, then expect to have it at the tips of your fingers when you go for boards 3 years later, right?
Yeah, for those of us, and sadly I have to include myself in this procrastinator side of life, that's not the best. I mean, the funny is, we know this intuitively, and it's so hard, but, a little bit every day. Those of us play bass guitar, you're not just keeping your calluses up, but, a little bit each day of practice is how you maintain competence.
And now I'm embarrassed because my bass is gathering dust in my office. So we better move on to dual coding, Justin, because I'm going to feel worse. So talk to us about dual coding.
So that's where dual coding, you're talking about, again, it's a way to create multiple connections to things. So dual coding is when you have something that's audio or something that's visual, written, drawn. You're putting different ways that somebody is receiving this information out there. It strengthens the knowledge. So, a lot of times when you're talking, I try to make videos where I do PowerPoint animation. I narrate over it. So, they're hearing my voice talk about how the coagulation cascade really works inside the body, and then I've got the various factors going across the screen and showing how they connect with each other and such. So that creates a much stronger memory than if I had just put out the coagulation cascade on a sheet of paper, or the cell-based model on a sheet of paper. That's going to have fewer connections and then be less likely for the person to remember it later. This morning I just had an anesthesia resident actually in my office, and that's what we were doing in the process of, is trying to get a couple different ways for that knowledge to come across.
Mm-hmm. Okay.
The fourth one there is interleaving topic. So this one may not see feel like it's that effective at first. This is where you're actually trading off different topics you're talking about. So, if you're getting ready for a board exam, APCP board exam, I mean, mixing a couple blood bank questions in with your anatomic slides, in with a little bit of chemistry, and then, a little bit of micro. This actually does a lot to strengthen the memory of what we're learning. And again, it's because I think it comes into this kind of desirable difficulties that you're talking about. You're kind of switching the modes of your brain a little bit, and you're getting used to recalling blood bank knowledge, for example, after having just your head, way down that chemistry thought process, right? And I mean, that's honestly, for those that are out in general practice, that's what your life is like every day. Of blood bank problems come up from time to time, then you work on a little bit of chemistry stuff and sign out slides and. So interleaving topics is another important way. The fifth way is to create some concrete examples, and I think something this really helps with is also transferability of the learned knowledge. So, when you're learning about something, trying to ask, okay, how does this come up in clinical practice? How is this going to be applied? Are there any exceptions to when this is going to be applied? That's going to help you. It's kind of like a hanger when we talk about clinical medicine or cases. That's why cases are so effective. They give us a patient that we dealt with, where we can see them in our mind and we can remember the situation so much better than if somebody is just theoretically talking to you about hemolytic transfusion reaction. Once you're there and help play a part in managing a hemolytic transfusion reaction, it sticks in a lot more because you have some mental hooks in your head. And the sixth one is elaboration, and that's where you think about the knowledge and what are the metaphors, for example, that you can use for that. What I use a lot are things like, when I'm talking about the coagulation cascade, I'm often talking about, initiation of coagulation and talking about that in terms of it's like the starter motor in your car. And, once your car turns over, now, your amplification, this is your engine turning over in your car, and you drive down the road. And, then you've got, a hemophiliac, that can't get their engine started, and, why we're going to use bypass therapy. And, these sorts of metaphors and stuff help us learn, because things like the coagulation cascade are classically so challenging. But if we have analogies, metaphors that we can use, it really takes away a lot of that cognitive load that's just kind of built into a lot of these topics.
So, and before we leave from there, Justin, I want to give you the opportunity to describe something that I know that that you have been involved in, and that's the Transfusion Tunes project. Would you mind just, because that involves some of that elaboration, and could you tell us just a little bit about that?
Yeah, so that was Teresa Malin and we went to a TEDx event recently, and there we saw a presentation, somebody talking about, try something new for 30 days and just do it, kind of thing, and we were kind of talking about what we might do, and then Teresa came up with the phenomenal idea of why don't we start using cartoons to draw out some of these transfusion topics, and it was just phenomenal. And it's been really neat to see the response and how getting some of these out there into the community, what the response has been, which is probably a testament again of how taking some of these different or novel teaching ways is really quite successful. The number of people that have picked up on this has been quite a bit more. And I think where we're interested in moving this now is with comics and graphic medicine. You can get into a lot of different perspectives than you can get with just your straight up teaching or cases that you might talk about. And so Teresa and I actually now are interested in a project of using our comics, the Transfusion Tunes, to educate about consent for blood transfusion and transfusion reactions.
Yeah.
And so that's the next thing that we're in the process of working on right now and going to start pushing out there. And with the idea that, those are the two kind of classic areas that have been problematic for clinicians. And if we're handling it in sort of this graphic medicine way, we're interested in, is this really going to get picked up on and commented by the internal medicine surgery community and stuff. And certainly then, we can show a couple other dimensions that they're not classically getting to see. For example, a surgeon might say, geez, why do I have to call a transfusion medicine doc with somebody that's got a transfusion reaction? It's not like this person's going to tell me how to manage this person's blood pressure or whatever. But after they learn about the transfusion reactions and start to appreciate that for most of them, we need to know so that we can protect either that patient or other patient in our hospital from similar complications. And so we're really excited to this being a medium that prompts people to pick up, just like we all used to probably pick up the funny papers when our grandparents were reading the paper on Sunday morning, and we hope to capitalize on some of that curiosity and then capitalize on the ability to shift perspectives from both being at the bedside to in the laboratory. What are the concerns that different people that are involved in this, as well as the patient's perspective that's being consented to and then is going through the transfusion reaction. So I'm really excited about that.
It's very cool. It's really super well done, and it's really fun. So can you tell people how they can find what's out there right now? We're recording this in the middle of July of 2017. So as of now, where can you find that info?
Sure. So I think probably the easiest way is to open up Twitter. So go to twitter.com. I hope you all have accounts, but you certainly do not need an account to see this. And when you open it up, there's a search bar in Twitter, and you can do hashtag, which is that little pound sign or number sign, depending on how you learned it. But hashtag and then transfusion tunes as one word.
And tunes is TOONS, right?
Yep.
Transfusion tunes. Okay. It's highly recommended, everybody. It's very cool and very fun. And you guys did a great job with that. Well, so Justin, we're pretty much out of time, but I did want to give you the chance to kind of wrap this up. There is, I will freely admit, way more than we could talk about than we've been able to. But this has been great, and I think you've brought up a lot of really, really important points. But why don't you bring it home for us? What are things that you want to leave us with?
Three main points. The first one is we just have to appreciate that education really has a critical role in clinical practice. And certainly, I think you made the point, Joe, that we've got experts in our community that are experts in education, and we should probably seek those people out and ask them for advice to make our lives more enjoyable and our lives more effective. Two is, I think we need to remember to be learner focused. And so, if we just sort of look back the next time we're going to do something, an educational event, thinking about, are we really being a coach here, or is this more about me as the teacher? And, that I think it pushes us towards, if we're going to be learner focused, it makes us doing more active learning. Not saying that students have to stand up and bounce on their head or nothing, but it's the students have to do something with what we're telling them, whether that's mental, physical, whatever. But by being learner focused, it's prompts people to be active in their learning, think about what's really an appropriate way to assess them, what's really a meaningful way to reflect on this process. And then the last one is just kind of reinforcing this idea that, we think about using backward design to achieve these standardized outcomes. However, use that flipped classroom approach to individualize your process. So, we want standard outcomes, a resident SBB who's graduating, we want them to achieve these standard outcomes, but we really have to individualize the process of how they get there.
That's awesome. Well, this is, Justin, as I said, this has been really, really excellent. And I think you've brought up a lot of wonderful and terrific learning points for all of us as we go forward, being lifelong learners and helping those that are just starting out to figure all those things out, and for all of us as we go along. So thank you so very much for doing this.
Thanks, Joe, for the opportunity and really highlighting education. It really plays a central role in our lives as laboratorians.
You know, as we close this, I really want to reemphasize once again, this is not just for people in training or for those in teaching positions. We are really all learners, and understanding how our brains work can really help us just be more effective. So please head on over to the show page at bbguide.org/037. I'll have a lot of resources there for you so that you can take more steps toward effective learning. Well, thanks to Justin Kreuter for appearing on the podcast. Thanks to each and every one of you for listening and for your feedback. Again, give me that feedback on the show page. I interact with people all the time there, and I'm happy to interact with you. Next time you're on a computer, go to iTunes and give this podcast a rating or review. Again, really, really appreciate it. So that's it for today. Thanks again. And once again, as we close, I hope that as you go through your day, that you'll smile, that you'll have fun, and above all, especially today, never, ever stop learning. Thanks a lot. We'll catch you next time on the podcast.